To minimize the exposure risk of various healthcare professionals who are dealing with the different contagious diseases, it is the proper use of personal protective equipments. I myself, Anupama U, staff nurse working in General Hospital Ernakulam, is here to introduce regarding the proper donning and doffing technique of personal protective equipments. I am going to demonstrate the technique of donning and doffing of personal protective equipment which I have got training from the National Institute of Virology, Pune. Let me introduce what all personal protective equipments are present in a PPE kit. First, you will have a pair of shoe cover. Then you will have the coverall with the hood attached to it. Then you have the goggles, then the N95 mask, gloves. These are the things available in the PPE kit. Now you have to keep the disinfectant solution, diluted disinfectant solution, a hand sanitizer and a micropore. This is Dr. AB. He will be demonstrating the proper technique of donning of personal protective equipments. First, you have to change yourself to a comfortable dress. Either you can wear an OT dress or a t-shirt with the pants. Make sure that you have worn shoes that completely covers your foot. So first, now doctor is going to perform hand hygiene. Palm to palm, dorsum of the hand, both hands, interlace, knuckles, thumb, fingertip, wrist. So after performing hand hygiene, doctor is now going to wear the personal protective equipments. Dr. AB is going to disinfect the stool which is placed in the donning area with a diluted disinfectant solution. A 1 arm distance area should be disinfected. Now he is going to wear the first personal protective equipment, that is the shoe cover. Before wearing the coverall, you have to check for the proper functioning of the zip. You have to check for whether any damage is there for the coverall. The zip is okay, there is no damage. Now doctor is going to wear the coverall. Hold it completely grasped in your hand. Wear the pan part first. You have keep one assistant in the donning area so that he or she can help you in the proper donning technique. He is now going to tie the knot of the coverall. You have to tie the knot towards the side and back of your body so that the knot is least contaminated. Now you have to secure this zip so that it is not rolled down while you are taking care of your patients. To secure the zip so that the zip won't be rolled down, you have to plaster it with a micropore. Just make the zip maximum up and just below the zip put a micropore plaster so that the zip won't roll down. Make sure that the hood of the apron is till your eyebrows level. Doctor is now going to wear the N95 mask. The lower lace should come behind his neck, under the ears, and the above lace above the ears and behind the head. Make sure that the lace are not twisted, because you are there for duty for almost 4 to 6 hours, and if the lace are twisted, then there will be some sort of irritation and involuntarily you will scratch on your face. So to prevent that, make sure that the lace is not twisted. You can roll your fingers and check that the lace are correct. You yourself can do, or with the help of the person who is present in the donning area, make sure that the lace are not twisted. After you wore the N95 mask, make sure that you have completely done the fit check test for the N95 mask. Just hold the mask like this and give a wide blow into the mask, and you have to check for any leakage. Either you can check the leakage with the help of your assistants, no leakage, or you can feel the air coming out. Now he is going to wear the goggles. Make sure that the upper part of your hood is completely inside the goggles. Then with the help of your assistant, you have to make sure that this area is not exposed. Or you can keep a mirror in the donning area so that you yourself can check out whether any exposure is there. Now the last one is wearing a gloves. You have to select a gloves of appropriate size. Okay, the first glove you wear is mainly for the protection of the healthcare personnel. So make sure that after the sleeve part of the apron is completely inside the gloves, and you have to secure this glove with the apron with the help of a micropore. Secure it with your apron. At the end, just bend a little so that it can be removed easily. Okay, now he can wear the second glove. Now the second pair of gloves should be above the first glove. It should come over the micropore that we have already sticken to the first glove. Now the doctor is completely ready to go to the isolation ward to take care of the communicable disease patient. There is no exposure. We have sticked the micropore. Now he is ready for the duty. Doctor now reaches the doffing area. There is nobody to assist him in the doffing area. He himself has to do the doffing procedure. Before doffing each personal protective equipment, he must disinfect the personal protective equipment and then only discard to the yellow bag. First, he is doing complete disinfection of his body. He is disinfecting in front of the mask, front part of the goggles, chest of his body. Thoroughly disinfect the hands, both the hands, head part, N95 mask, then his lower limbs. He has to do it meticulously. His foot part, the knot, back of his body, then the inside part of his foot. He must give a contact time of around 15 to 20 minutes. So he can wait for 15 to 20 minutes. Now the doctor has given 15 to 20 minutes contact time. He is going to remove the personal protective equipments one by one. First he is going to remove the goggles. He removed the goggles and disinfected with the disinfectant solution. Yes, lace part. Discard in the biomedical waste management bag. Perform hand hygiene. Perform all the steps of hand hygiene. Now the doctor is going to remove the N95 mask. Holding the lower lace, he first remove the lower lace. Just hold the lace and remove the upper lace. Hold the N95 mask by the lace. Disinfect the lace also. Discard the mask in the yellow bag. Perform hand hygiene. Now the next PPE to be removed is the coverall. Hold it in one hand. Remove the other one. Hold along with the first plaster. The plaster attached to the sib is removed. Hold the three plasters together, disinfect and dispose. Dispose it. Perform hand hygiene. Again do hand hygiene. Perform all the steps of hand hygiene once again. Now he is going to remove the hood part of the apron. Roll it down inside out. Roll it inside out. Perform hand hygiene again. Now he is going to remove the apron. He is pulling his left hand out. Pull the left hand out. Roll the apron inside out. Roll it, secure it. Roll it inside out. He is inserting the left hand inside, pulling out his right hand, rolling it inside out. Now rolling down. If you feel that your hand is again contaminated, you can do hand hygiene. Roll the PPE downwards. Remove one leg first. Yes. Roll it. Hold it securely. Remove the other leg. Roll it. Yes, disinfect the apron completely. Discard it in the yellow bag. Now doctor is going to remove the shoe cover. Roll the shoe cover inside out. Remove the shoe cover. Yes, keep it inside the other shoe cover and roll it down again. Hold both shoe cover in the hand. Disinfect and discard. Perform hand hygiene. Now doctor is going to remove the gloves. Disinfect and discard. Either with the disinfectant solution, or you can use the 60 to 70% alcohol based hand sanitizer. Perform all the steps of hand hygiene. After doing hand hygiene, you will be having an area to wash your face and your hands. So after removing the glove, doctor has to go to the washing area and he has to perform the hand hygiene, and he should wash his face with soap and water. Then he should take a shower after washing his face and hand, and he can leave the area.